Glenna, you're here today. How many weeks after your surgery?
7 weeks.
7 weeks. And I did your surgery to reconstruct a very, very important tendon in our foot and ankle called posterior tibial tendon, right?
Correct.
And you were referred to me by a dear friend who originally saw you for your tendon issue. And you guys tried everything non-surgical, and you were still in a lot of pain. And I think when you came to me, you were in a boot, right?
Yes, she had put me in a boot and told me to come straight to you.
And basically, you had an MRI done, and it showed that you had a tear in the posterior tibial tendon.
Correct.
And it's a very, very important tendon because it's basically the tendon that supports our arch. And if you look, in all the flexor tendon, it's the strongest tendon, and it's basically what happens is when people don't have it repaired, they start losing the arch, and then the arch collapses, and then they develop arthritis. And guess what? There is no cure for arthritis, right?
That's right.
So we kind of said, okay, we've tried the boot, we've tried everything, and we're going to go ahead and repair it. And you had your surgery done, almost 8 weeks ago,
yes.
right?
Mm-hmm.
So how much better are you?
Oh my goodness, since I come in, I would say 85% better. It's amazing.
You feel like the surgery was worth it?
Oh, definitely.
Good.
Like I said, I couldn't have went on with the way it was. So,
right, and I told you that basically we really did it more like a long-term situation, because I see a lot of patients who, go to their primary cares and they say, oh, old age, right?
Yes.
And then they come in like 6 months later and they're completely collapsed. Mm-hmm. They're walking on the inside of their ankle, and sometimes, unfortunately, it's too late to go and repair it because fusion is the only option. But there's another reason why I'm doing this, not only to say, hey, great, tendon repairs work, but we also utilize that special graft on you. It's called Amniox, right?
Correct.
And it's basically an amniotic membrane that they derive from scheduled C-sections. So it is a human, it's not a bovine, it's not an animal graft, which we used to use until very recently. And I think the reason why you've done so well in such a short time is because it's kind of like an icing on a cake. And as I explained to you, suturing a tendon together is like suturing a steak.
Yes.
So you suture it, but it kind of always rips a little bit. So what we do is we wrap that amniox around the posterior tibial tendon to reinforce the repair. Mm-hmm. And to be honest with you, as I told you, you're in the top 5% of how well you've done. In obviously 8 weeks in surgical terms is a very short period of time. Mm-hmm. So pat yourself on the back. You've been a great patient, and you've done extremely well.
Well, the procedure worked very well.
Good.
I mean, I was just so pleased to being able, and like I said, just following your instructions.
Right.
And it has done well.
Right. Well, I think also the key element is you gotta listen to your doctor, right?
Yeah, that's probably true.
Helps a little bit, right? So, all right, perfect.